Hello, thank you. Good afternoon, everybody. It's nice to be here again. What a great week that this has been of webinars, and I think this was just a phenomenal opportunity to get to present this information in a new format as we're all adjusting to kind of the new ways of the world. So as Catherine had introduced, I'm Andrew Bledsoe, Deputy Executive Director for the Office of Health Data and Analytics, where I have the privilege of overseeing the Kentucky Health Information Exchange. And with me is Ann O'Hara, who's really going to be going through the fun stuff that we get to talk about today with some of our new services that we are offering. So go to the next slide. So before we jump into some of these services, I have to lay a baseline for who we are, what data we exchange, and what we do. And so if you were able to listen to me yesterday, it's just a few minutes of a recap. But if you stuck with me through the two presentations, this is the third time, and they say you need to hear things 3 times before it's committed to memory. And so this can be your commitment to memory here. So we are a health information exchange that is owned and operated inside of state government. And this is fairly unique against other HIEs across the nation. And it really proves a lot of benefit to the healthcare facilities around the state. One thing that it gives us is the opportunity to work very collaboratively with other agencies inside of the cabinet, which directly provides benefits to you as a healthcare organization in the state. One of those is the Department for Public Health. We are able to facilitate all of the public health reporting as we are established as the Public Health Reporting Authority. And that is really just because we're already working with the facilities. We have a whole team of people dedicated to onboarding facilities electronically. And so it made sense for us to do that work so that we can allow DPH to do the work that they're meant to do with their public health work. And so other agencies are Medicaid. So we work on a lot of different projects and initiatives with Medicaid, but one of the most important things is because of our relationship, we are able to have access to federal Medicaid dollars to offset the expense of operating the HIE completely. And so that directly to you means that we do not charge for any of our services. However, the caveat is to that your EHR vendor will likely charge you to get the data from your system to ours, but we are not charging for our services, so we're able to bear that cost on behalf of you. A few others, we're doing some really neat projects with the Department for Community-Based Services, with the foster children population, partnering with the OIG to show the CASPR data so that side by side you have clinical information and the CASPR information. So just a few of the ways that we're able to collaborate, but there's a lot more specific use cases and projects that we do ultimately benefiting you, but really just speaking to the uniqueness of who we are. So this next slide shows kind of what we do. I'm a visual learner and I have to map everything out and use lots of pictures and colors. And so, but really what I'm trying to depict here is a push and a pull of information. So that push of information could come from you are a good steward of your patient's health information. So, part of providing quality care to a patient is ensuring that the patient's providers have access to their information, especially as they're transitioning from one place to another. So providing that information into the HIE means that you are helping to promote good information dissemination appropriately that ultimately helps that patient to receive quality care. So you could be pushing information into KHIE on that patient. You could also be pushing your public health reporting information. So this is for some of the quality payment programs, very important, but also against certain legislation and regulatory requirements on your facilities to report that information. And again, just for the good of the population health, making sure that that information is available so that public health can appropriately respond to the needs of the state. So that's the pushing of the information. The pull comes from pulling information back to you on that patient. So it could be you have a new patient coming into your organization, you maybe work in an emergency department, you have non-communicable patients, whatever it is. If you need to know information on your patient, you can query KHIE. We do all the work of going out and finding as much as we can collect, and we present that back to you in an easy to view product, which is what Ann will be demonstrating in a little bit. So this again is just that push and that pull that we facilitate, kind of setting in the middle. I think about us as kind of like the cloud in the sky. You know, they talk about the cloud, we're sending data into the cloud. We help facilitate a cloud here in Kentucky for health information. I love this slide. This slide is pretty old, but it really does a good job showing the difference in the information that we collect. So up until now, really all that we had to go on, up until a couple of years ago, was claims information. What we have done with claims information is quite tremendous. We've built a payment model around it. We've built analytics platforms, quality programs around that claims data, but it can only tell you so much. It can tell you that it has been done, an event has occurred, a test has been ordered, but it can't tell you what the outcome of that was. It can't tell you the lab test results, the radiology reports, the vital information, demographic data. That's what we are able to exchange from the EHRs. So claims, it's a good amount of data, but nothing compared to what we're able to get with our connections. So we connect directly to the EHR systems, and we can either go in and grab it or they can give it to us, and that's what we can ultimately provide back to you. And so I just think this is a really good depiction of how those two can relate to each other. But it also makes me think of another image. I don't know if you've ever seen the iceberg, where you can only see a little bit on the surface, like you can only see 10% on the surface, but the 90% is underneath. That's kind of what we've been dealing with in the past. Claims can only provide out 10%, well, and that's an estimation, but can only provide out a certain amount of information on a patient. But we're able to go in and collect the rest of the information as we work into and map deeper into the EHR system. I like to be very specific when we talk through the types of data that we at KHIE contain, collect, and exchange. So I'm going to go through and explain some of these in more detail. ADT stands for Admit, Discharge, Transfer, and it is really the baseline for everything that we do. It gives us patient information, and it tells us where patients are seeking care. This builds our master patient index, which is where we attribute all the information to one unique individual. So in order to do that, we need the name, address, phone, date of birth, and several other identifiers, so that when we're getting information in and we're reporting information out, we can make sure that it is all appropriately aligning to the correct individual, and we don't end up with duplicates in our system. We don't want you to query into us for information and you have to choose which patient, but they're actually the same patient and there's multiples in each one. So we're able to leverage our technology to condense that down to make sure that you're only looking at the patient that you are intending to be looking at. Some features of our new system is we're able to collect additional information above that basic demographic data. This could be clinician information. There's a lot of different clinicians that's mapped into these messages. There's admitting clinician, referral clinician, treating clinician. It can capture diagnosis information. So we do have the diagnosis codes. Facility location, this is pretty unique. I have seen some of the messages come through that actually tell us that a patient is in room 208 on the 9th floor of X hospital. And so it can help you to better understand, where a patient has been, where they're currently at, and also has proven to be a help to us with some of the COVID reporting that we're doing. We're trying to understand what the hospitalizations and ICU utilization has been directly attributed to the COVID. We also capture next of kin. So if you're needing to contact relatives, insurance information, secondary insurance information. Really one of the biggest ways that I have heard users of our system benefiting from these ADTs though is from the phone number and address. I know that it can be pretty difficult to capture the most recent contact information for a patient. And so we would have the most recent information up to their last visit that they have had with a health organization that is connected to us. So we've seen a lot of people be able to find some benefit out of that. Okay, so moving from ADT on down to lab results, this would be reference labs. All the reference labs in Kentucky are connected and sending us copies of their lab reports. We also have connections with commercial labs. And so really this was a lot significantly pushed from the pandemic as well, because we were all of a sudden trying to capture a large amount of test results and sending those into DPH. And the best way to do that is electronically. because it helps to negate manual entry on behalf of multiple parties. And so that was a good push for us to be able to start working with a lot of the commercial labs. And so you will start seeing a significant amount of commercial lab information available in the HIE as well. Radiology reports, this is transcribed findings or recommendations from a report, from a read image. Although I am glad to say that as of last Friday, we did receive approval from CMS to launch into a new project where we will be starting up an image exchange that works with our HIE, so that we will be exchanging copies of those images as well, so that you can log into the system, see the clinical information, see their images as well. So that will be a huge project for us that we will be kicking off soon, and we'll be onboarding as early as January for that. So stay tuned, more to come, lots of exciting information around that. Other transcribed reports, this is really just a catch-all of information. So different EHR systems are capable of sending different things. And this is how we can kind of account for that. We've seen anything in there from operative reports to emergency departments, history and physicals. We've even seen some cancellation notices in there. A lot of the times this is free text information that's been entered into their EHR system that we're able to capture and collect through that feed. CCDs is where we're really getting into a lot of the deeper information. If we have a facility sending a CCD or a summary of care, also named as, they're required to send the following elements. Now, there are things that they can send beyond those elements, and it's almost endless, the information that they can have included in a CCD. But this is what's required, and this is what we most commonly see. A lot of common things above that I've seen is care plan information, care teams. There's also an opportunity to include radiology information in there, lots of other things. But those would be some of the most common elements on top of the requirements here. We also show any paid Medicaid or MCO claim in our system as well. There's a lot of very valuable information in there. I have seen it used a lot around care gap closures. So if you're needing to know if one of your patients has had a test done somewhere else, if it was paid by Medicaid or MCO, you can see that they've already had that test done. It can also help to alleviate duplicate testing or anything that you would be needing to do with the patient if you can identify that they've already had it done recently. Also to alleviate any issues with billing if tests or anything has already been done as well. There's a lot of information there, but that's kind of the caveat to it. There is a lot of information, so you have to have the appropriate time and resources to be able to go through that, depending upon the patient. And lastly, we have a lot of immunization data. So we have a connection to the immunization registry, where anytime there's a query to us, we can reach out to the registry and get that information on that patient and provide that as well. So that's the types of data that was available. Here is the amount of, or the number of facilities who are sending us that information. Hospital column is obviously hospital. The other column is primary care providers, specialty providers. We have dentists, we have chiropractors, and some of our non-traditional contributors as well, such as all of the community behavioral health centers are sending some type of data into us. We have city, county, and state correctional facilities who are contributing data. And one that I just find really neat is the EMS system. Every EMS run sheet is available in our system that's filed with the Kentucky Board of EMS. And so the regulations for that is that the EMS is required to file their run sheets with the Kentucky Board of EMS. So really theoretically, we should have every single EMS run sheet in our system. Now, there is a caveat to that because they have 30 days to file that if they're not capturing it electronically in a system. So it's not exactly available in real time, whereas all of our other data is available in real time. That EMS data has a little bit of a lag to it just because there is that 30-day window for them to contribute it to the Kentucky Board of EMS. Also, I'll note at the bottom of this platinum, that is the number of organizations who are connected to us sending summary of care records or CCDs. Now, a number represented on here represents one business and not points of care. So, for example, the University of Kentucky would be represented on here as one number and not, you know, whatever number of sites that they have, just to kind of give you a frame of reference. So we've talked about what we do, we've talked about what data we exchange, and we've talked about the number of facilities who are contributing to us. I want to talk through how we make our data accessible to you. And we do this through several different services on here. And I will talk through each one of these in a little more detail. The first is through our ePartnerViewer. This is our web-based application where you can query for patient information. So we give this to anyone who has the HIPAA authority to view patient information. And all you would need is a patient's first name, last name, and date of birth to find the appropriate patient. And then you query into this system and it reaches out and collects all of that information and provides it back to you. This is actually what Anne's going to be demonstrating in a little more depth in a few minutes. So I won't go too deep into this stuff, but just to highlight a few things, we do have over 6,500 physical locations reporting into KHIE, and this would be one of the opportunities that you would have access to see all of that information. We have direct secure messaging capabilities embedded in there. We have the CASPER reports embedded into there, event notifications, lots of different things that we have put into this ePartnerViewer to make it easy to use and as much information as possible. So the next way that we make data available is through our Platinum connection. This is where we're really getting into true interoperability and addressing workflow barriers. Our ePartnerViewer is tremendous and wonderful and presents information in a really easy to see format, but it is still an external application. Although it's easy to get to, you still have to go to the internet to access it. Platinum allows us to deliver all of our HIE information into your EHR system. So the way that that works is you could be working in your EHR. I have an example here of Epic. And so you query for that patient information. Sometimes it's a manual query. Sometimes it's an automatic query when a new encounter is created. I've seen it done both ways, depending upon the EHR system. So that comes to KHIE. We reach out to all of our stakeholders. That could be Medicaid, doctor's offices, hospitals, the immunization registry, OIG for CASPER data. And we bring that in and we wrap that in a nice little package and we send it back into your EHR system. Now from there, your EHR system is going to display it how it natively displays information. Sometimes it's in just a read-only format, and so you can read through it as a one long summary of care record. Most of the times, though, you're able to parse specific elements to specific components in that patient's record to do medication reconciliation. So like you could take, or not medication, information reconciliation. So you could take the medication, you could take allergies, you could take diagnosis and send that directly to that patient's chart. And it would save that in there as external information. Again, really the main thing here is we are sending our KHIE information into your EHR. Now there is a caveat, not every EHR is capable of doing this. This is a kind of a deeply integrated solution. So it does require some a significant amount of investment in time and resources to be able to do this type of a connection. But what you're able to see on the backside of that is truly beneficial. So this is one of our premier service offerings that we are able to provide. Next is through event notifications. You may or may not know, over the last 2 years, we have undergone a technology transition, and we wrapped that up about January. And so one of the new features of our system is our ability to proactively send out information on patients that are coming through our system. And so the way that we do that is through event notifications. So the way this service works is you tell us who you want to track, and anytime one of these events occur, we tell you about it. And so that could be hospital admit discharge, emergency department admit discharge, a readmission within 30 days, behavioral health admit discharge, inpatient and outpatient, ED overutilization. So if you have a patient that has been seen more than 4 times in an emergency department within 365 rolling days, it would send you a notification. Because we know a lot of if you're in the MIPS program, some of those quality components are tied to your ability to manage one of your patients and how long that they're and how often they're in the emergency department. If a specialty visit has occurred, if a toxicology screen has come back positive, lab tests are ready to review, and then if newly added is a COVID-19 positive test. And so if we can go to the next slide, I can't exactly remember, Brent, what my next slide was. Yes, okay. So how does this work? So first, you tell us what patients that you want to track. And so once you have given that to us, we log that in our system. So then when a patient presents to a facility or an event occurs, for example, the patient is admitted to the emergency department, they send us that ADT, which I'd just like to point out here that we are working with every hospital in the state of Kentucky. So it's fairly comprehensive. So they send us that information that that patient is in the emergency department. And then we cross-reference it around the individuals who have told us they want event notifications. And then we send that out to them. So Andrew Bledsoe steps into the emergency department. My primary care provider has said, I want to know when Andrew goes to the emergency department. And so it sends them that notification. Now we can deliver that in 3 different ways. The first is through the ePartnerViewer, which I know Anne's going to show in a few minutes. Next is directly into your EHR system, if you have one of the EHRs that are capable to receive that information. And last is through direct secure messaging, which direct secure messaging can be set up to go directly into your EHR, or it could be in our standalone Caroline product. So really, we have worked to build this to be as user-friendly for anyone, regardless of their technology limitations. Next is our patient alert query. So our event notification system is built around you telling us what patients you want to track. That might not always be the case. If you have new patients coming into your office, if you're an emergency department and you have patients coming in, you don't necessarily know who you want to track. So the patient alert query is built to provide you important information on those new patients. The way that that works is you develop this query so that there are trigger events in your EHR system. Typically that would be starting an encounter. And it automatically in the background does a query to KHIE and says, tell us what information you know about this patient. So we have 2 use cases set up right now. One is for, the first is for COVID positive. So it sends us that query and we can immediately tell you back that this patient has tested positive for COVID. This patient has previously tested positive for COVID, or this patient's status is unknown. This is one of the features that we have developed really quickly to try to help facilities to know more about the patients that are coming into their facility. The next use case that we've set this up for is what we call XDRO, extreme drug resistant organisms. So for any time that a patient has a positive CRE diagnosis, we will send that back to you as well, letting you know that your facility needs to use special precautions for that individual. Coming in just a few months is one based around neonatal abstinence syndrome. So it would do a query, we would do the query to us and we tell you immediately if that patient has previously been diagnosed with NAS. I know that this has been a project that we've been working on with Dr. Connie White and Public Health because we know that it's important for a provider and a facility to know this about a patient because it can dictate how that they treat the patient and the ways that they approach treating the patient. So it can be very important. So very exciting. Lots of features and functionality here. This is a very simple query to us, a very simple connection to us. It sounds complicated, but it's typically set up in a very simple manner. And one of the simplest ways that we can connect to a facility. Let's talk through Casper. So we talked a little bit in the beginning that we are able to leverage our relationship with the Office of the Inspector General to have access to the Casper information. And so we present Casper data primarily in 2 ways. One is through Platinum, and the other is through our ePartnerViewer. So the way that that works in Platinum is, again, we send in the Platinum connection data directly into the EHR. With the Casper report, if that's included, you get a summary of care on the clinical information, and you get a separate document containing the Casper report. In the ePartnerViewer, I don't think it's a part of this demo, but it just shows up as another portlet where you can click on and view the Casper reports there. Medicaid claims, we kind of talked through a few of the use cases and what we see a lot around the care gap closures, looking for information on attributed patients, maybe some of their previous diagnosis, a lot of medication information in there. If Medicaid's paying for their medication, there's a lot of that information as well. We have seen some organizations doing specific use cases around this information. One was they were identifying abuse patients in the pediatric populations. So they were able to sift through and look at emergency department reports, diagnoses, medications, and identify those abuse patients. ED overutilization, because we can see if ED encounter was paid, substance use, a lot of different use cases. Again, a lot of information that's potentially available to you there. I think lastly, this is direct secure messaging. And so this is a mechanism that you can communicate electronically patient information without having a really deep integration in place. So direct secure messaging is essentially an email system that you can exchange protected health information. We have several different layers of direct secure messaging integration. We have a connection where we can send information directly into an EHR system. We have a standalone portal that can help facilitate that. And we also offer a direct catalog. A couple different use cases here, but one that we primarily use this is if you are with a clinic or a hospital, you may have an EHR system and you're wanting to communicate to some of your referral partners, but they don't have an EHR system. So we can provision them access to our Careline portal where they can log in and electronically receive your information. So you can send it electronically, they can receive it electronically, and then communicate back with you. So really, if you think about it, this one of the main things that we're doing here is replacing that fax machine, because direct secure messaging does have a lot of security parameters around it. It is a much more secure mode of information transmission as opposed to the fax machine, where we all know it's not a very secure method. And then one of our other functions that we briefly touched on earlier is our the establishment of us as the Public Health Reporting Authority. And so really what that means is we are facilitating your public health reporting to the appropriate public health agency. The way that I like to think about this is you build an interface to us, to KHIE. That interface is kind of like a highway in that a highway has multiple lanes of traffic, and interface has multiple lanes of data feeds. So we are looking at like an ADT data feed, a radiology, an immunization data feed, and each car would be a specific message in that data feed. So the yellow car could be Andrew Bledsoe's ADT message, all coming in the same interface to KHIE, and then we identify and send the appropriate information to the appropriate authority. Kind of the alternative to this is you would have to build, as a healthcare facility, interface individually to each one of these registries, which would cost you a significant amount of time and resources to maintain. So again, this is another opportunity where we're able to carry the burden of some of your costs in facilitating this information exchange. And so this is a listing. If you're curious about what you are sending to us, what you could be sending to us, or some of these expanded services, I would urge you to reach out to our outreach coordinators. They are some of the funnest people in the world. So if you're just looking for a good conversation, even just give them a call, and they can help walk you through what our services are more in depth and what it should mean and could mean to your organization. And with that, I'm not gonna hand it over because she's already took it. She's already taken it. Ann O'Hara is gonna talk you through our ePartnerViewer, which is the web-based portal, and how anyone with internet access can view the KHIE information. Ann, you are on mute if you're speaking.
And here we go. Everyone, do you?
Here you are.
Here I
hear
am.
you.
Yeah,
Yep.
for a fun time call. So everyone, thank you very much for giving us an opportunity to show you the ePartnerViewer. We are very excited to be able to roll this out to you. Just to let you know, this is where you'll find patient health data in a consolidated format. You'll be able to retrieve CASPR reports if you are CASPR credentialed. You'll also be able to receive immunization and Medicaid claims data as well, as Andrew had spoken to before. So the first thing you'll come to is a terms and conditions page. And really what this indicates is that you have a treatment, payment, or operations purpose to be in the ePartnerViewer, since we are dealing with patient health information. So you click accept. So I just want to let you know that we are operating in a test environment today. So you'll actually see KHIE smoke test. But if we were doing this with your organization's name would appear here. So we're going to proceed to the portal. And while that's loading, I do want to let you know that this application is a web-based application. It's secure, it's auditable, it's trackable. So you'll be able to retrieve information if you if you are interested. So the first thing we come to is a landing page known as the My Dashboard page. And this is kind of like the control central. Everything springboards from this particular page. So from here, you'll be able to do a patient search. You'll be able to see any patients that have been bookmarked. Now, this is an internal operation. So when you're in a patient's chart, there'll be a tab that will allow you to bookmark or unbookmark a patient. And the reason you would bookmark a patient is because you're following them because they're either medically fragile or they're a diabetic patient, whatever the rationale is behind it. It gives you an opportunity to kind of make that patient your favorite. And so when you're on the landing page, when you look under bookmarked, it will show how many and which patients are bookmarked. And the reason being is this is an actual hyperlink, so it negates the need to go back and do a quick search. So also on your My Dashboard page, you'll see any event notifications. Now, Andrew had just alluded to these before. So here you'll see Chewable Flintstone, he's 20 years old. He had an emergency department discharge from UK on August 13th of 2020. And you can see some other notifications as well. So the nice thing about seeing the notifications is that if you wanted to go directly into the patient's chart, again, since this is a hyperlink, you've got the notification, you could just click that hyperlink and go directly to Chewable Flintstone or Bobby Brady or I'll Have Another. Andrew just discussed our direct secure messaging platform. This is one of the ways that you can reach our Caroline platform, which again is when KHIE enables you with a direct user email. And this is the platform, again, like Yahoo or Gmail, where you could actually send and receive encrypted messaging. And then let me move myself out of the way. Right here you see support, and that's just as it sounds. If there's any problems with the system, there is an email address and there's a telephone number that you can call and get help with any issues that you're experiencing. So anytime you're in the system, your name will appear up in the right-hand corner. And when you see that, you see this drop-down arrow, that indicates that there's some options. So for example, you see there's an option on preferences, and I'll get into that in just a few minutes, and then a log out feature. So just to let you know, the system will automatically log out after 15 minutes of inactivity. And it's kind of neat. It will actually give you a 2-minute warning. So it will ask you if you want to resume activity or if you want to just log out. If you miss that message, you can, again, it will automatically log you out after 15 minutes. And that just adheres to that HIPAA privacy. So let's go ahead and do a patient search. So the two pieces of mandatory criteria are first name and last name. So we're going to put our patient in, Bobby Brady. Now, if you have the date of birth, that's great because it really refines the search. However, if you do not, there's an advanced search feature that will allow you to select the sex of the patient and an approximate date range. And then you would just hit search. For our purposes, again, we're going to put in Bobby Brady and his birth date. As I enter this birth date, please note that you have you need to enter 2 digits for the month, for the date, and then 4 for the year. But under those preferences that I had mentioned before, if you want to realign this and do year, day, month, year, if you want to do military time, the system allows you that opportunity. So we've got Bobby Brady in here. We're going to hit search. And our master patient index has gone out and we have one patient match. Here's Bobby Brady. He's 50 years old. So this is the patient we're looking for. So we're going to go ahead and hit view. So what's happening right now is that the system is going out and it's actually collecting data from 3 different sources. It's collecting data from the KHIE participants, those 6,500 participants across the state. So if Bobby Brady has been to any of those locations, that information will come into this consolidated patient chart. In addition, if a provider is sending a continuity of care document, and it is on the KHIE repository. The system also pings the repository as well as the immunization registry. So let me go ahead and put myself down here. So as you can see, this is Bobby Brady's consolidated health chart. We've got our patient demographic information here. This is where we would bookmark him if we wanted to be able to get to his chart quickly. And you can see if we wanted to unbookmark him, it's just merely a click. If you wanted to see some more information like telephone information or MRN information, all you do is click more. So we're going to go down below. The date selection defaults to 12 months, but you can refine your search if you want to default or if you want to do a search for 3 months, 6 months, 9 months, or if you want to customize a search, you would just hit this tab or this button and you would put in your date search parameters and hit retrieve. But for our purposes today, we're going to operate on the 12-month default. So as I had said, all of the information that has been collected on Bobby Brady from those 3 sources have all consolidated into this row of tabs. So all of the information on Bobby Brady lives in this tabular view as you see it right here. Now, that's one way to view the information. Another way to view the information is in what we call a portlet view. So we actually parse out the medications, parse out the allergies, the clinical documents, so that you can actually go through and view the information in this format. And one of the reasons you might want to do that is because it's a quick snapshot of Bobby Brady. So because it delivers up to the last 5 most recent encounters. So, and the system allows you to either open the information in the portlet view or open it in the tabular view. 6 of one, half dozen of another, truly your preference. However, since I said that, it is your preference because in addition to being able to see the information in the portlet view, you can adjust these portlets to correspond with your workflow. So say, for example, medications and allergies weren't important to you. You can actually hide these tabs, or you can realign these tabs in whatever format works best for you. So each individual user in your organization can have a customized view of the ePartnerViewer. Now, again, as Andrew had said, if you were Casper credentialed, you would be able to see a Casper portlet. It will say PDMP or Casper, one of the two, but you must be Casper credentialed in order to see that information. So let's go ahead and start. So let's look at the medications and allergies first. So medication information will actually open on the left. You can see the blue line highlights the medication. So you have a lot of opportunities here for historical data. So for example, it says that the item is showing 12 items, but the system only defaults to 5. So what you want to do is go down to the right-hand side of your screen, click all, and that lists all the items that has been that we have on Bobby Brady. So anytime you see an apply filter, it means that you can sort. And the sorts are super easy. Say you just want to see if he's on lisinopril, you would just put in the first few letters of the medication and it would pop up. Or you can sort by ordering physician. And to back out of the sort, you merely just erase the sort and everything will come back up again. So again, I am going to say we are only as good as the information that's being delivered into KHIE. So I just want to let you know that this will never be an entire consolidated health record on Bobby. It's so much more information than we've had in the past. So let's go over to allergies. Looks like there's 11 allergies on Bobby, but we better go down, and if we want to see all of them, we'll just go down and click all. You can see all the medication or allergy information that has been obtained on Bobby. So now we're going to go to, let's go back to patient summary and say we want to go in and we want to see some consolidated continuity of care documents, otherwise known as summary of care document. So just to let you know, any piece of clinical information that comes in on KHIE, KHIE will put into a summary CCD. Okay, we're going to back off of that. And this is actually how you would access the KHIE portal. Not sure what happened here, a little technical difficulty, but that's okay. We're just going to go ahead and get back into our system. And Andrew, if you want to like cover for me for a second, that would really be helpful.
You want me to sing a song? Like
I want you to do something for me, my friend, because I am experiencing technical difficulty.
Well, as Ann said, this is going on. We're doing the demo today from our test environment, and we're having to do so much work for the COVID response that the test environment can fluctuate from time to time. And so I'll talk about some of the work that we are doing around COVID. And so that can help to kind of explain what's going on in our test. So one of the biggest things that we have done is really work to onboard as many of the commercial labs and hospitals for what we call electronic laboratory reporting. And so through electronic laboratory reporting, we capture the positive and negatives COVID cases inside of your electronic systems and send that directly into the DPH's disease surveillance platform. And so what that means is you no longer having to manually send in that lab test information from your side, and the epidemiologists on our side are not having to manually enter that information into their disease surveillance system. And so we have been really ramping that up and working with as many commercial labs as possible. And through a collaboration with DPH, they have now required that anyone who is doing any COVID lab testing, that they are required to send that through a KHIE interface. We have positioned an entire team of people to solely be dedicated on this for the next 3 years, not necessarily because we think this is going to go on for 3 years, but after we kind of get through the COVID rush, we are looking to expand this beyond COVID and do this for all of the communicable diseases as well. Now, building upon that electronic laboratory report is electronic case reporting. And so for electronic case reporting, so the lab report says that there is a positive or a negative lab test result. The case report can give you all of the additional background information. So like demographic information about the patient, where was the patient when they contracted this disease, who was the treating facility, who was the treating provider, what medication, death status, if applicable. And so the way that that's traditionally currently done is an organization fills out an EPBED 200 or 250 form, and then they manually send that in. And again, that's then manually entered into our system. And so we have just very recently went live with electronic case reporting so that we can capture that information when you enter it into your system, and we can send it directly into the DPH's disease surveillance system. And so we have significantly cut down on the amount of time and resources that have to be utilized to manually fill out that information and transmit that information into DPH. And so lots of cost savings for the organizations, especially if you're a larger organization. I know some of the facilities, they have multiple resources tasked with only filling out those forms and manually submitting that in. So it has been truly a game changer for reporting, and we hope to just be expanding that rapidly. Now, there are only a few EHR systems that can do electronic case reporting. So there's a little bit of a limitation from that perspective, but we are working on opportunities to be able to make it more widely accessible across as many EHR systems as possible. We have a really good relationship and collaboration with the CDC on this. So it's kind of the collaborative effort is with the CDC, the Kentucky Public Health, the Association for Public Health Laboratories, and some of their vendors, and we have all worked collectively to be able to help facilitate this. And so it is exciting to be able to see a lot of this information now flowing electronically, and it's helping to improve the timely reporting of numbers. So when you see the numbers that the governor's reporting out at the end of the day, that's kind of what we are helping to facilitate a lot with this electronic laboratory reporting and electronic case reporting. Anne, do you want me to keep going?
I'm there.
Yeah, you got it.
So
Great.
this is a great example, and I'm so sorry, ladies and gentlemen. This is a great example of being able to use the bookmark feature. So we're going to go ahead and hit bookmark. Again, the system is going out and it's pinging the participants. It will ping the KHIE data repository, and it will ping the immunization registry, and it will actually give you a countdown of how long it will take for all of the information to consolidate. And here we go. So let's go ahead and move on to a lab. So again, we're in the portlet view. So we'll go ahead and open the labs. All of the labs load on the left, and each lab, once you highlight it, will present on the right. So as you can see, you can see the ordering physician from the lab. You'll see the date of the specimen, and you can see that there are 5 items showing. So it means you'll be able to see the complete lab, and then you'll have a flag. If the value is above or below the reference range, a flag will appear. This one is a triangle with an exclamation point. Now, if the reference range is critically above, if a value is critically above or below the reference range, you'll actually see a lightning bolt. So again, we have an apply filter functionality. So we can go over to the filter documents. Say you're looking for urinalysis, you would just put in the first few letters. You see there's 13 items showing. You want to go down again, click all, and you'll be able to see the entire lab. And again, to back out, you would just erase that search and you'll have all of the labs. Let's go over to pathology. Again, same way, there's an apply filter search. You can filter the documents. You can also organize the documents by date if you click this tab. Here you'll see the presentation of an x-ray for a hip. And let's go back to patient summary view, because again, I want to show you how the tabs correlate with the portlets. So let's go down, let's go see a radiology. Let's open this radiology report. As Andrew had said in his presentation, the radiology reports present in a written format or a transcribed format. And again, you'll be able to see the ordering physician and the date. If there were several, you could apply the filter and search the documents by leg, chest, whatever. Also under this radiology report, this particular tab, if a provider is sending any other transcribed reports, you would see it under this tab. So here you can see we've got a history, we've got, it looks like a medication reconciliation, and we have allergic rhinitis under that report. Now, images. Andrew had said earlier that KHIE is in the process of connecting with the hospital PACS systems to deliver images so that eventually, hopefully by the end of the year, you'll be able to see like the x-ray report, maybe a CT scan, an MRI. That information will be recorded in the ePartnerViewer. Next, we have encounters. So the system will be loaded with encounter information. And this is kind of interesting. Poor Bobby Brady did not do well once he left Hollywood because as you can see, you can either scroll down, you'll see the start date, the end date should be in the live environment. You'll see the diagnosis by the clinician, pecked by a chicken. Just to let you know, that is a real ICD-10 code, only to be topped by sucked into a jet engine, which is another live ICD-10 code. And you'll see the location. The same will appear for both your problems and the procedures. Under your problems, you'll find the ICD-10 code, and then under procedures, you'll see the CPT code. Moving on to immunizations. So as I had said earlier, the system will default to 12 months, which is what we have our search on right now, for every component of data with the exception of immunizations. As the system goes out and queries the immunization registry, it will actually pull everything over that's in the immunization registry. So let's go down and look at Bobby. It looks like Bobby had a meningitis shot on January 28th of this year, but it's kind of interesting. I was talking to a provider who said he checked himself in the system and he saw an immunization in there from 1997. It's kind of interesting. Uncategorized, this is kind of like the junk drawer of our kitchen. Everybody has a junk drawer in the kitchen. Everything's important in the junk drawer. It's just, it doesn't have a particular home. Since our system is new, um, for if for any reason, as the system is retrieving clinical data, it does not recognize where the data belongs in which one of these clinical tabs, it will put it in the uncategorized tab. So more often than not, we're seeing labs and pathology reports. So here you can see a lab. Looks like we have 3 labs here, and it doesn't look like there's any flags, so there's nothing that's out of the ordinary with these particular labs. And then KHIE has gathered information. If a provider is sending information on billing or social determinant, you can go down to the MRN. You can pull up, this is St. Clair's Medical Center. You have your dates, you hit retrieve. Okay, so let's try another. Okay, so we actually have some data. Let's go ahead and open this. Here we see some social determinant information. We've got next of kin, and then we have some insurance information. And again, this is really rich information if you're looking, that would help your billing department or whatever. I think under clinical documents, I'd like to go back to that for just a moment because I know we had done the KHIE summary. Let's go ahead and go back into that. So again, this is a summary of all of the clinical data that you see in Bobby Brady's chart. So the top presents in a, you see the patient demographic. Then you go below, like a typical CCD, you'll see different hyperlinks. Say we want to see his medications. You can just go ahead and click that hyperlink. It will take you directly to the medications, or you can scroll down and see the information. The nice thing about the clinical documents view is that you have an opportunity to send this information either to yourself or onto another physician or clinician, I should say, as long as you have a direct secure email address. And I know that Andrew had mentioned that before, and this would be an opportunity to meet one of the transitions of care. Also, just to let you know, Medicaid claims data, as Andrew had said, is part of our system. And the Medicaid claims data will actually show up under the clinical documents tab. And again, it will present in the same format. You'll see the demographic information. You'll have the hyperlinks to, let's say we want to go down to see the procedures. You'll be able to see the date, the CPT code, and a definition of the procedure, location, where it was enacted. And again, let's go back to the top. And once more, you'll be able to send it, because it's a clinical document, you'll be able to send it via direct secure messaging. So this is also where you would see anything, any individual event coming in by providers who are sending continuity of care documents, as well as the emergency medical service. Any first responder information will be under the clinical documents as well. So that pretty much concludes the clinical portion. And again, our event notifications you can access on the home screen. And I would be delighted to, as would Kelly or Tiffany or Teresa, would be delighted to do a customized demo for you and your organization. So thanks so much for your time. Andrew, you did a great job covering for me. I very much appreciate it. And in the interim, if there are any outreach coordinators, Kelly or Tiffany, if there's anything you want to add, go ahead and jump on in. Otherwise, I'm going to turn this back over to you, Andrew.
Yeah, so I'll say one final thing as far as how you can get access to the system. And so probably the easiest way is go to our website and you can click on the tab that says ePartnerViewer, and there is some contact on there, and it will show you how to very easily get in contact with the right person, or if you were able to pull information from the map earlier, feel free to contact, yes, thank you, Brent, feel free to contact your outreach coordinator directly. So with that, I did receive a question, and it is a great question. The question is, are there audit logs or reports that show who or what has been accessed from a facility? Yes, every click that is done inside of the ePartnerViewer is auditable to the individual. And so we do provide those as requested. It's not an automated report that you could request, but you can request through us. That's a great question. With that, I know that we are right at our time. So, Catherine, I'll throw it back over to you and see if you had any other questions, or if we maybe have used up all of our time.
Well, it's really close, but we have time for one question. And it is, if I have my own direct secure email address, do I need to use KHIE to meet my MIPS measures?
Yes, you can still use us, but you don't have to use us. So kind of one of the good opportunities about KHIE is we can help to provide you access to a lot of additional information. So one of the measures that we had talked through using your own direct secure address would be if you were working on the health information exchange measure and you were trying to accept summaries of care in to do the information reconciliation, you could log into the ePartnerViewer and type in your direct secure messaging address, and that would send the summary of care directly to you. It is from another facility. It's just facilitated through us. And so that then allows you to do that information reconciliation. So that's one of the ways if you have your own direct address. Also, we would ask that anyone who has their own direct addresses to please log that with our direct catalog. And so our outreach coordinators can help facilitate that communication as well. We want to make that as robust as possible. We have about 4,000 accounts that are logged in there. So if you're looking at people that you need to send to via direct, you can use that as an opportunity to try to help identify people that you can send your transitions of care referrals out to electronically.
Great, thank you. And thank you so much to our partners at KHIE for this presentation. We really appreciate being able to work with you to help healthcare providers throughout the state deal with everything that's going on in healthcare today.
Absolutely. Thank you, Catherine. We really appreciate the collaboration. It truly benefits the healthcare communities across Kentucky because we're able to come together and you can help guide them in the way and we can provide the technology to facilitate it. So thank you.